And welcome back, everybody. Thanks for sticking with us. Bob Elinskas is our guest. Bob is from the American Cancer Society, the local branch of the Cancer Society, up on Lamont Place. We're talking about lots of things that are happening with the Cancer Society. Relay for Life being the big signature event of the Cancer Society, but Making Strides is another big event for you guys.
Yeah, that's in October, Breast Cancer Awareness Month, and we bring the community together to walk and celebrate those that have battled breast cancer as survivors, those we've lost to breast cancer. It takes place at Masonic Care Community. This year it'll be October 20th. And it's a 2.5-mile walk, goes out from the campus around and back through Acacia Village. But it's a wonderful day, and seeing all the different teams out decked out in their pink. I mean, you'll never see as much pink as you will on that day. It's pretty amazing.
What does that raise money-wise, Bob?
This past year raised around $160,000, which is pretty great. You know, we're certainly thankful for that. Some great volunteers involved with it, and great survivors, great stories out of that as well. But breast cancer is certainly one that I think strikes a lot of people, and this is their way to fight back for that.
The other, I mean, those are the two that we think about, that I think about anyway, Relay and Making Strides, but you've got some other ones. I'm just looking at the things that, the events that you brought me. What is the Burgers at Brews?
That's a new event for us. We've teamed up with Saranac, and it's usually once a month for June, July, and August. And basically, we work with a local restaurant. I'm trying to think of some of the ones from last year, like Taylor and the Cook was one of them. Places that don't normally do hamburgers will do a gourmet version of a burger. You can sample that and get some Saranac brews at the same time, listen to a nice band, and it's just a great evening for a couple hours. It's, I think, $20, and like I said, just a fun evening out and a way for us to make some extra money and fun research.
If you were to take all these events that you have locally, and we haven't mentioned them all, but if you were to take all the events that you have locally, how much is being raised for the American Cancer Society here in a year?
Probably my best guess is probably somewhere around $850,000, $950,000. If you count memorial donations, if you count just general mail donations, things like that as well. It's incredible to see the level of support we get from the community, and that's why I always say I can't thank people enough for what they do. Whether they write a check for $10 or they're putting a team together that raises $10,000, it's all enables us to fund more research, fund those type of programs, and do the education and advocacy that we want to.
And part of the money goes for, what would you call it, customer service or client services?
Well, patient services is a big part of what we do. And so earlier in the show we had mentioned that we do loaner wigs and wigs through our local office. So we have patients that will call us up, they're going through treatments and they need to get a wig. And whether or not they have the funds to purchase one, they can come to our office. We have brand new wigs, some that are human hair wigs, some that are acrylic. And they can get fitted there, take it back with them, and then use that for the duration of their treatments. And we have patients, probably 2-3 at least every other week or so, that come in and are fitted for those while they're going through treatments.
And you also do transportation, do you not?
Yep. In fact, we're looking for more drivers too. So if someone's retired and they want to do something like this, give us a call. We'd be happy to train you and tell you a little bit more about the program. But any patient that's having a hard time getting to either their treatment visits or their oncology visits can give us a call, and we'll try to match them with a volunteer driver if one's available to pick them up from their home, bring them to their appointment, and then back home again.
And I know you told me this, I remember it well, you said that the first call you would like people to make after being diagnosed is to the American Cancer Society.
Yeah, we're there for help and assistance, not only with information that people probably figure we might have, but also linking them up with local resources. So whether it's one of our programs like the WIG program or like Road to Recovery for rides, even if it's a program that's not one of ours, we can steer them and direct them to other programs that might be helpful, make their journey a little bit easier as they're facing this battle. Are
you seeing any kind of a win to this? Are you seeing progress?
Well, the good news is we just heard that since 1990 the cancer death rate has gone down 26%, which translates to pretty good numbers in terms of lives saved. you know, there's still far too many people diagnosed. There's still far too many people passing from this disease. And so we continue to fight every single year, but it's encouraging to us to see that death rate continue to go down. And it's because people are getting screened. It's because they're taking better care of themselves. Some of our early detection methods are getting better. All of those combine together to make that death rate go down.
Is the smoking element involved with those numbers as well, Bob?
Yes, because as you know, smoking impacts a risk factor for a lot of different types of cancer. So, I mean, if I had heard at one point, if we can get everyone in the world to quit smoking, the cancer death rate would probably drop by half. It's that much of an impact on things. So, you know, I would just continue to tell people, if there's any chance you can try to start quitting, go ahead and do it. It's the best thing you can do.
You were involved with, there was a coalition here, I don't know if it still exists or not, but there was a coalition of groups that got together.
Yeah, Smoke Free Mohawk Valley. That started up from Commit, those that would even remember that long ago.
Commit, that's what I was trying to think of.
And now it's Bridges from Tobacco. And so it's the same grant, but just continues to evolve. And they're still active, still cover the area. There's a cessation grant, so there's cessation services in the area. So for people who want to go to a local support group for smoking cessation, they can do that as well. But of course, they can call us anytime, and we can provide them links for any of that.
And when the cessation, this is for somebody that wants to quit but not quite sure how to go about it?
Yeah, they can help them make a plan for this. It also can steer them to resources like how they might be able to talk to their doctor or their health provider about getting patches or gum or other types of assistance. Working with whatever insurance they have to maybe cover other resources that might be out there, like some of the prescription medications as well.
Mm-hmm. I remember when I was trying to quit smoking. Wow, they didn't have any of this.
No.
And, well, I had hard candy and chewing gum and carrots.
Yep, rubber bands, those type of things, yeah.
Bob Elinskas is our guest. Short break, right back.